Hi folks, I'm going to warn you right now, this video is not well edited, but I put it together real quick because it's very important. It's about what CAS is doing and what you guys can do to help us put out protective acrylic shields in the wake of this coronavirus COVID-19 crisis. If you follow us on social media, you know that we've been producing shields that protect our healthcare workers who are intubating these critically ill patients. So bear with the video. It's going to jump around a lot. I'm going to start right to the part where we start talking and showing the shield. You'll see a demonstration and just stick through it. It's important. You can see how you can help us.
This is the opportunity of a lifetime, right? That, we've forever made cases and graded toys and given people awesome custom displays. And there's a lot of value in that. And, I take a lot of pride, and I know that you do too, in making people happy with, their collectibles and what we do. But, never in a million years did I think we'd have an opportunity to make something that could make such a difference and help a lot of people that are really the heroes on the front line and doing a lot of the work. So,
yeah, we were talking this week, and I said it's kind of like it's corny, but it's funny that we all our little childhood heroes we like have protected them in acrylic, and now we're using that same acrylic to like really protect the true heroes of today, which is the doctors and all the staff and the nurses on the front line. You brought up a good point that coronavirus or COVID-19, it's highly contagious. It's through aerosol droplets, and when you intubate someone, even though if you're wearing a mask, a mask is not 100% protective. It's contagious through the eyes. And when you intubate someone, you are looking at them in their face. And if you're intubating them, they're usually in respiratory distress and they're coughing, and all those aerosol droplets are right in your face. And so what we've been finding, what we've been hearing is that the doctors, the nurses, the EMTs, all on the front line in the ER or in the ICU that are intubating these people, they're the ones that are getting affected, and they're going down. And when they go down, that's our first line of defense. So here is the box, right? The box is about, I think, 20 inches wide. It's probably about that tall as well, maybe a little taller. This is the front of the box. You see that the front is mostly open, okay, so I can stick my hand in it. There are two holes in the back where where whoever's intubating it will be standing. And then there's side holes, one on the right and left. All right, and it's very easy to handle. I know Ken modified the design. He put these side holes in so that you can shuttle ventilation tubing and central lines through it. But this is the best way to actually hold it. It's actually very easy to handle. And then there's these cutouts for the shoulder. So all right, so hopefully not cut off your hair here. You can just squeeze down a little bit. There we go. All right, so here you see now you can see that okay? Yep, perfect.
Yeah,
so
see it perfectly, Anthony.
All right, so basically the two holes are in the back here. All right, so you can see that this is all covered. So if she were to cough, I'm shielded. How you doing? And then I can fit my hands in, and I can do anything I need. I can actually see down her throat. There are specialized devices where you can see what's going on in someone's throat, like on a monitor, but not everyone has that. So sometimes you actually need to look down the throat. And you can imagine if someone's coughing and very contagious, you don't want to do that. But you can do that. You could lift up the person's jaw and look down as you insert the endotracheal tube, and you're completely protected. So that's basically how it works. And my hospital was very interested in using these to transport patients. People who are intubated in the ICU need to go get tests, and they're very afraid to be transporting these patients when civilians and other staff are in the same hallway. So you can put this on the hospital bed. They're intubated, or even if they're not intubated, they act as shields. But then you can then use the tubes to come out here and hook up to a ventilator or a bulb that you would manually ventilate them with. So that's a great modification that Ken did. It's awesome. So, all right, I think you're off the hook, Erica.
Yeah, Erica, nice job, nice job, nice job.
Thank you.
Well done, well done.
Matthew is working his tail off. He is basically spearheading all the logistics of where all these boxes go. Most of the requests from hospitals come in, they go to Matthew. He's the one keeping track, talking to the doctors and the nurse coordinators and everyone, making sure they get what they need, they go where they need to go, and he's doing an awesome job. So Thanks. You have to deal with like very confusing emails from me. I know. So I
No, no.
appreciate that.
You know what? Thank you for being for the most part, the first line. You're the guy talking to them. Again, you speak the same language. Being a doctor, I think there's a level of respect which your peers. So you understand more so than we do of what they're going through day to day. You know, with some of these emails that we're getting, it's just heart wrenching, gut wrenching.
Yeah.
Like what you talked about, the woman in the ER doctor in the South Bronx. But she said it's a war zone. Their entire ER is now an ICU. They went from 30 beds to over 130 beds in the ER, 100% ICU because of COVID. It's one of those things that's, you know, 75 emails in the last, 48 hours?
Not even, right? Yeah.
Not even, exactly. We've got requests for 150 of these boxes in about 70 different hospitals. And this is ranging from hard hit epicenters like New York and New Jersey, but also Florida, Kentucky.
South Dakota, right? So we have
South Dakota.
South Dakotas, yeah.
Exactly. Kentucky, Washington State, which I'm in Vancouver, Canada, and Washington is an epicenter. It was the first one in America, first area that really got hit because it was in long-term care homes. Yeah, some of the other requests, there was a woman that said that they have to deal with a cardiac arrest in a nursing home or in an ER, and they're using a garment bag to stop any aerosol, any airborne particles because they cannot get
It's crazy.
the protective gear. It's insane. And hearing that over and over from these emails, it's just like, oh my God. So yes, you've been saying it, I'm going to say it. If anyone watching, donate, please, whatever you can afford. It's important. It's a good cause. We're not making a cent on this. We're just covering the cost to get these out to these hospitals. And these hospitals, there are some people, I've got an email up right now saying, we've been trying to get PPE, personal protective equipment for a week. It's a hospital that can't get anything. And they're saying thank you to us, to CAS, for being able to make and provide these. And
they say thank you. That's we're like, no, thank you. This is nothing. Thank you for being on the front line because
exactly.
You guys are the brave ones. And you said these shields. You know, if you think, oh, I won't make a difference, you make a difference. You put in like $20. That's 1/5 of a shield. You know, you and 4 other people can fund a shield, and you probably. I mean, you see all the emails. We've had responses from folks who have said things like, these shields are going to save lives. And so just think about that. You'll have a hand in protecting, people, anyone in the hospital, but especially those frontline healthcare workers that are fighting this for us. So
exactly.
Ken Black, one of our co-owners, the original owner, and one of our acrylic artist. How talented is he that he basically looked up the CAD plans on Sunday night and by Monday had a prototype? I think that's unbelievable.
Amazing. Yeah. And he and Todd and, the team has been working so hard. And these guys, Ken's just been cranking them out. And it's incredible,
Yeah.
So
I think
kudos to him.
I think the team, Todd and Lee and Ken, and today at 5 in the morning on a Saturday, to just crank these puppies out. So tell us, what is the best way if you are, number one, someone in healthcare, you're a doctor, you're a nurse, you think this can help your hospital, what is the best way to get in touch with CAS so that we can get these to you?
Well, again, if you're on Facebook, you can look up Collector Archive Services. We're there. Info at Collector Archive Services is easy to remember. Email us, then I will get the email, from there. We will address it. Anthony or myself will contact whoever is contacting us. We've had nurses, we've had directors of medical facilities, we've had doctors, everyone.
We've had collectors whose relatives are doctors and nurses reach out to us on our collecting site saying, hey, can you hook up, my relative's hospital up with it? And if you're in healthcare and you have some technical question, you're not sure about this, you feel free to reach out to me, Anthony at collectorarchive.com or the Instagram Messenger, because I'm the one who gets them. So I'll be happy to answer any questions.
Yeah, and myself, Matthew at collectorarchive.com too.
Perfect.
Send it out, and we have our GoFundMe page up and running.
Yes.
And I don't know where we're at, but anything anyone can afford.
Let me check. I got it up
Make a donation
on the iPad here. So that has been incredible. The outpouring of generosity and people who want to help is unreal. Like, we can continue to make them. So, you know, hospitals, again, they're floored. They're just they're beside themselves when we say, give us your address, you will have them. Don't worry about paying. Don't worry about paying. It's a big deal because they're putting a lot on the line. They don't have to worry about that as well.
And again, it's across the country. It's not just CAS is located in Florida, but we are shipping everywhere.
Yeah.
So
Washington, South Dakota, everywhere.
Yeah. If you are watching this and you have relatives or friends that are in the medical profession and you want to ask them if this is something they can use, please let us know. We will send it out. Please have them contact us. We want to help out. And this is our little way of doing it.